It takes all the pressure off. I can drive without pain, and hopefully by next week sometime or the week after, I'll be back out on the workout floor.
Yeah, very soon, definitely. With these type of problems, we want to progress them in a smart way. Range of motion, some stability exercises when the symptoms are down to a manageable area, and we make sure that they're not returning with any increased activity. Then we'll start doing a little bit more intensive rehab. Hey everybody, it's Dr. Ward Kalkstein here at Kalkstein Chiropractic. Today I'm with Marcus, a local golf pro and instructor at Golf Tech in Timonium. Marcus.
That's right.
That's right.
Been coming here for a long time. He's doing great, and then messed up my shoulder last week working out, and you guys are bringing me back to where I can actually go to work this week. So yeah, so the tape's been helping a lot, supporting my arm up like this, getting a lot of pressure up in here. We've been dry needling it, stem, ice, ultrasound it all, and I'd say last weekend, since last Saturday, the pain's probably down about 50%.
What did it feel like when it first happened?
Like someone was constantly stabbing me here, and like two bones were rubbing back and forth on each other. No matter what movement, when I drove, I had to literally grip myself like this, hold up, otherwise I'd be screaming and yelling in pain. Yeah. I couldn't really drive more than like a mile without like needing someone else to give me a ride.
That was last week,
That was
right?
on like Monday and Tuesday.
Okay.
And then as the treatments went better, and then you recommended that I go get prescribed steroids and muscle relaxers, that's helped a little, but I think just what we're doing here in the tape is giving me more relief than the drugs.
Yeah, I gotcha. So sometimes when someone says to me, I can't sleep, it's significant to the point where it's affecting my motor function, those type of things. I can't control my arms driving. It's affecting his way of living in a reasonable manner. And this is somebody that wants to find other resources to help him out. I'll say, hey, talk to your primary care. A lot of times co-coordinating with the primary care, a pain management doc, or even an orthopedic doc can be really helpful for this type of a problem, okay? So let's take a step back. First off, if you're in Baltimore and you want to fix your golf swing, come see Marcus. He'll do it in like 2 visits.
That's not a guarantee, but
I'm gonna guarantee it because I don't have anything on the line. But
I've fixed Dr. Warren's slice, and his wrist positions are getting a little better, and he murders the ball.
Yeah, we have a lot of fun. Golf Tech's an awesome place, so check them out down on Timonium Road. And then besides that, so coming in, he had this really big flare up. Well, what's going on? What's causing this type of severe pain where he feels like someone's stabbing him with an ice pick? There's 2 things that can kind of come into play when it comes to this problem. So whenever you have an issue like this type of neck pain, you use what's called a differential diagnosis. So based off his symptoms, based off his history, based off his exam, we start to put in a hierarchy of what we think the problem is. One being the primary diagnosis being the thing that we think we got the most confidence or reassurance in, that based off his exam and his history, that's what we think is going on. So for Marcus, C4, C5 radicular symptoms are really prevalent in his exam. So C4 being the 4th cervical vertebra, C5 being the 5th cervical vertebra. Those areas have nerves that come into the shoulder, into the arm. They control motor and sensory, or motion and feeling. And when you have inflammation, irritation, or what you call a pinched nerve, it can present like that, where he's getting a pinching, stabbing sensation. That inflammation or that problem can occur on Marcus in a couple areas. It can be where those levels of the spine are. The problem could be right here, okay? But you can also have irritation to those nerves in other areas, and you call that an impingement syndrome, or where the nerve is entrapped, okay? Potentially he could have some entrapment along his medial shoulder blade that's giving him that really sharp shooting pain that's occurring here, okay? So what are we doing to help out with Marcus based off his exam and based off those differential diagnoses that he comes in with? We're dry needling his erector spinae muscles in his neck and his upper back, okay? I'm adjusting him in a comfortable position that gets motion to this first rib and this upper thoracic and lower cervical spine area. So the chiropractic pop, or the crack, that a lot of people know that we do. I'm moving those segments to get better motion to that tissue, okay? And then I'm giving him some support through kinesio tape or through K-tape or whatever tape you've got out there, you name it, to get this tension off of either the peripheral nerve or the nerve root irritation here, okay? So we're taking him through a trial of care to see how he responds to that. Now, if you've played golf before, if you're a golfer out there, you know that it's repetitive motion and it's a lot of force going through your body to hit a small ball, okay? And in order to hit that ball far, you need to increase speed and velocity and drive all your force through your hands and through your shoulders and through your back as you're following through with your swing, right? And so Marcus is trained and he's got that skill down so well, but it's still a stressor on his body every time he does that on a regular basis. And I mean, he's booked out for like 3 weeks at a time. He's busy. He's constantly showing people different things. He's probably showing people the wrong things sometimes to show them what they're doing. That probably doesn't help his upper back or neck.
I always tell people the spine changes flexions 4 times in about 1.5 seconds. For me, earlier in the week, I couldn't even flex or extend without shooting pain. It was miserable, like to where I thought I thought a bone was broken or something.
Yeah.
So then, so I just want to get back to where, like I was a couple weeks ago. Been doing good in my workouts. It sucked I couldn't work out this week because my shoulder got jacked up, but I'm hoping by next week or the week after everything will be back to normal.
Yeah,
and you said it'll come back stronger, right?
That's the goal with these things, right? Is that we kind of use this as motivation to push past it and focus on maybe where that problem stemmed from in the first place. So let me show you how I adjust Marcus now, okay? Let me put my face up for you real quick, and then I'm going to show you how I'll tape his shoulder just to give him some support, so that he doesn't feel like that shoulder is dragging on his upper back so much.
Yeah. When I said to you that I had to hold my arm up, that kind of triggered you to be like, let's tape it. And then the tape was great.
I don't always use tape for a pinched nerve, but if people are telling me, I did a conversation with a group at Logan University, Rehab to Performance Club, and Sebastian was on there. Remember, we kind of talked to them a little bit, and we talked about that a little bit about Bacody's sign, where that arm is being held up. There's tension in this area. That's why I think that primary diagnosis that I'm kind of sitting on, being this nerve root being irritated here, Marcus, is why I'm focusing so much on your upper back and your neck. Doing okay here?
Hurts a little.
How's that pressure?
A lot.
Okay. When I come to the opposite side, is this okay?
Yep.
So just let everything fall. Good. Just a little pressure and release. Good. Good. I'm gonna bring you out, Marcus, and I'll watch you turn now, okay? So, like, just watching him just press up and get off the table and use his back muscles to throw himself up. Marcus wasn't doing any of that stuff.
I was miserable Monday and Tuesday. I didn't even want to talk to anyone, and I'm a big talker.
You were getting quiet on me.
Yeah.
Right, relax for me. And just let me watch you turn to that right shoulder as far as you can comfortably go. Good. And then come over to that left side. Good.
Still a little restricted there, but not
go
as bad.
onto the left, correct?
Mm-hmm.
Yeah, we're going to do one more. Just bring your head back for me.
That hurts.
That's right in here, right?
A little lower, but yeah, right in there is pretty bad when I extend.
Yeah. So I'm going to have you sit in the chair, okay, Marcus? And let me pull it away from the wall just a tad. There you go. And Liam, you can go do a little dosey-do that away for me. You're good. Relax back.
What?
Good.
I will.
Let your head come this way. Good. Now let your head fall back. You're going to feel pressure and release, okay? Take your left arm and support it on the chair. There you go. Good. Let your body rest into my fingertips now. Good. There's the pressure and there's the problem. Good. Perfect. Is that good? Yeah. Go ahead and stand up for me. Let's go ahead and tape that shoulder. So he got dry needling, he got heat and stim, he got adjusted, and then we're just doing a tape to help support what we're doing in here. He's doing McKenzie or stretches for his neck, so we're combining a couple different therapies to get him to respond as fast as he's responded in just this week, right? So we're fortunate that we've got a good team here and the right resources to be able to do that. Bring your shoulder up. Just the shoulder itself, you can keep the elbow down, good. And back. So I'll do a piece of tape right across his deltoid, and I'll pull his glenohumeral joint back and attach it to where that supraspinatus muscle sits up top of the shoulder blade. Good, and relax. So that brings his joint back a little bit, and then I want to support it in a vertical view. I want to put some tape through the trap and towards that deltoid tuberosity, or the lateral portion of his shoulder. So for that one, Marcus, hike straight up. Good. Good, now relax. Marcus, we kind of talked about this. Keep the tape on for 2 to 3 days. You can shower with it on. If it's bothering you at all, just take it off. If it's itching you at all, take it off. This is just meant to give us a little bit of support between treatments, right? This isn't supposed to be like you're not going to need tape on your shoulder forever, right? This isn't like the, we joked around about this being the magic tape, and it's really magical, but it's not a permanent type of magical, you know what I mean?
Yeah, I mean, you see athletes, like I was telling you in the
Didn't
needle
you say
room, I
Woods?
saw Tiger a lot of times, and Justin Thomas both have right there on their neck taped.
And they're up on one side or both sides?
Both sides, and then I've seen a lot of LPGA players have stuff on their leg taped because they're allowed to wear skirts. So the PGA guys might too, but we have to all wear pants, so you never really know what's going on our legs. But
Yeah.
I'd say on the LPGA, if you watched coverage, you'd see at least K-tape on someone's calf or somewhere on their leg.
Yeah,
It's just very common.
I
And
like
I never
using it.
really understood what it did until I got taped this week.
What's in your words? What does it do?
I just think it kind of gives me a crutch without having a crutch on, and it takes a lot of pressure and restricts motion, and it kind of helped me understand why a lot of people I teach that have shoulder restrictions can't do some of the things that I want them to do in their swing.
Because you can see what happens when those muscles aren't working.
Yeah, so so it was a good learning experience for me, even though the pain sucked. But it's getting better.
That's a good way to look at it, man.
Yeah.
So that's a good way to put it, a crutch without having a crutch. So he can still move. It's not stopping him from moving. It's not stopping from his arm from pulling on his shoulder, but it's just assisting him, right?
Yeah.
It helps with his range of motion. It helps with the pain.
Yeah, so I feel like my shoulder's just up like this without it being up like that. It's just held that way.
Yeah.
And it takes all the pressure off. I can drive without pain, and hopefully by next week sometime or the week after, I'll be back out on the workout floor.
Yeah, very soon, definitely. With these type of problems, we want to progress them in a smart way. Range of motion, some stability exercises when the symptoms are down to a manageable area, and we make sure that they're not returning with any increased activity. Then we'll start doing a little bit more intensive rehab.
Yeah, because I got pretty far in the workout.
Yeah.
I mean, I was way up in the FSP. I mean, I'm a graduate beyond graduate.
You almost
They're
went
doing-
from a Kalkstein Chiropractic face mask to a sweatshirt and everything.
I know. And then one ball throw with bad technique, I think, did it.
Yeah.
Yeah, so we still don't know exactly how it happened, but just going back through, we think it was just, I do a lot of, well, not a ton, but we do kind of explosive ball throws in part of my warm-ups. And I said to Patrick that I think I pulled something in my leg, but we kind of took it easy, but then continued to do the workout, and I probably shouldn't have. So I'm not blaming anyone, because this could happen from anything, and obviously I have chronic pain. I've been coming here for years to get help, and it's great. It makes me feel good, and then it's just keeping up on the symptoms and not living in pain.
Yeah, so a couple of things that he's mentioned there, right? He's had neck pain for a lot of years. He's been a professional golfer for a while now, and just those activities.
An avid bowler
So
and
he's
hockey
bowling a lot.
player, so
Yeah.
all this stuff. Now I'm pushing 30, and it's all, I'm trying to get stronger. So
Yeah, definitely some obstacles when it comes to strength training. It's so nice that if we have any problems, or if there's anything that comes up, whether it's through training or whether it's through, a lot of activity in 1 week, which is Marcus and I talked a little bit about, like that week that he got hurt, there was just a lot going on in his life overall. He was stressed in that tissue in a lot of different ways. And so when you have those things and you got a team right here to help kind of build you back up and get you feeling good so that you can get back to that routine of getting stronger and healthier and not just say, no, I'm done. This happened and now I can't do X, right? It's trying to find the right solution for that person, giving them the catalyst to make it happen. So he's already gained a lot of muscle mass and is getting stronger through the program, and we'll keep making it happen.
yeah.
Yeah. All right, thanks for watching, everybody, and hit up Marcus. He's the man.